welcome to Breakfast with Louise Minchin and Dan Walker.
Our headlines for you today. One of England's most senior medical advisors says he's greatly concerned about a rise in coronavirus cases in the past few days.
If we don't take this incredibly seriously from this point in, we're going to have a bumpy ride over the next few months.
Professor Carl Hennigan is Director for the Centre for Evidence-Based Medicine in Oxford.
I think we've got a structural problem now. There's a problem with understanding risk, understanding uncertainty, and particularly understanding how to use the evidence to drive interventions and take forward the initiatives. If you understand how pathogens work at this time of year they circulate at about a rate of about 40 per 100,000 people because we're naturally social distance, we're outside. When we come to winter, they go up about tenfold to about 400 per 100,000. At that point, we call an epidemic. The people out there don't know this happens. That could be because of flu and so forth. So if we're now considering locking down at these levels, I do concern myself as we go into September and October, we are going to start to get in a mess because we're going to be calling lockdowns everywhere. One of the key about what you should worry about and concern yourself when you go into lockdowns is the impact on COVID disease, not on SARS testing. And by COVID disease, the hospital admissions, the critical care bed occupancies, the deaths. And to be honest with you, they're at such low levels, normally you wouldn't even know that was happening. And I think this is a problem now because all of these strategies that are being employed, masks, infrared thermometers, locking down here, partially doing there, is again saying the test and trace system has failed because the data is not getting quick enough to the front line. But it's also not recognising the wider issues that now exist. And then wider issues are hugely important and concerning. The impact on educational attainment, highly correlated with healthcare and outcomes, what we're doing to our children and where we're putting them in all of this. The economy is inextricably linked with healthcare outcomes. Never mind somebody's got to pay for all this. You've also got the problem of all these non-COVID deaths that I've talked about. The fact more people are dying in private homes than COVID right now, and it's been completely ignored. And the fact that 50% of people who report a condition is worsening, a non-COVID condition that can be life-threatening, are saying they're delaying their access to healthcare.
In Wales, Caerphilly becomes the first county to go into local lockdown after recent figures show it has one of the highest number of cases in the UK.
This idea of false positives is a really important issue. So I'm just going to walk you through this. I want you to think of, we go and test 10,000 people, which is, realistic right now. If I test 10,000 people and no people have the disease, nobody has it, and we still test, 10 people will still be identified as having COVID, despite there's none out there. Now, this is important, and this is a problem with screening. You get to a certain prevalence, it's very, very, very low, that the accuracy of the test has to be hugely important.
So basically what you're saying is, as a disease gets rarer in the population, the chance of having a false positive test starts to rise.
Correct. So of the 9,990 people who do not have the disease, 10 will still test positive.
That's something quite big to get your head around, because some of these tests are reporting that they are 99.98% accurate.
Well, I've just described a test that has specificity of 99.9%. Now, some of the tests around the world are actually much cheaper, delivered in much speedier times, and their specificity is about 95%. So they have a huge number of false positives at low prevalence, and that's a real concern. Now, one of the concerns I have is even in the ONS survey, they still don't understand the specificity of the test.
So this is the Office for National Statistics, who put out weekly reports about how many coronavirus diagnoses have been made, and they have said that they don't have accurate figures for how specific and how sensitive the tests are.
The Office for National Statistics admits they do not, quote, know the true sensitivity and specificity of the test.
More than 1 million people in Scotland are now subject to tougher restrictions after they were extended to 2 more areas overnight.
England's Phil Foden has apologised and says he will learn a valuable lesson after he and Mason Greenwood are sent home for breaching quarantine rules ahead of tonight's England game in Denmark.
Good morning. 2020's unpredictable weather means an unpredictable harvest. There are warnings that cereal yields could be at their lowest for 40 years.